Hi, everyone. My name is Bradley Firchow. I'm a fourth year medical student in the Rural Physician Leadership Program, and I will be talking today about going from reader to contributor, writing a Lancet correspondence. By the end of this presentation, you should be able to pick a target paper that's aligned with your area of interest, craft a thesis that adds value to a paper that you select, structure a one-page letter, and submit cleanly according to the Lancet's specifications. Now, first of all, what counts as a correspondence and what doesn't? Correspondences are short, timely letters that extend, clarify, or challenge recently published content. So this is not a full research manuscript. It's not even a research brief. This is often a 400 to 700 word, depending on the journal, essentially letter to the editors of the journal and also the authors of the original paper about some perspective that you have to offer regarding the paper. So along with this, it's a correspondence. So that means it's a give and take, and editors might invite replies from the original authors in response to whatever you say. Now, this is not the same as what is often called a commentary or a personal view or perspective article. Those are often invited and a little bit longer form and related to a topic of your own choosing. The correspondence is always tailored to an existing publication that is often not authored by the person who's writing a correspondence. So I've kind of developed a 5-step workflow that seems to work for me, and feel free to modify this as you see fit, but this is kind of what I've learned writing correspondences over the last year or so. So my first step is that I like to scan new issues of journals that I'm interested in authoring a correspondence for. So for me, so far that's been Lancet Regional Health Americas, which is one of the journals within the Lancet family. Other journals that I tend to monitor but haven't written for yet are like the New England Journal of Medicine and JAMA. Step 2 is flagging papers in my lane. So when I say my lane, I mean what I have expertise in or lived experience in or am actively doing research in. So for me, that looks like local public health, pandemic preparedness, and rural health, especially as it pertains to Appalachia. Step 3 is to read those papers I flag with a reviewer's eye. Step 4 is to generate a thesis. So this is what I'm going to add to whatever that paper says, or maybe what it doesn't say. And then step 5 is to build it out with a focused literature check. And then I try to write to the specifications of the journal on the front end, so I'm not having to go back and change the way I've written it or formatted something. It's always good to go through a journal's website, kind of see what they say, how they like things to be formatted, and just do it that way the first time. Especially if you're targeting a specific journal, it's really important to just get that formatting out of the way early. So we'll kind of go in and talk about these with a little more specificity. So step 1, scanning the new issues. Something that a lot of people do is use eTalk, RSS, or keyword alerts. So instead of having to go to the journal website after each issue comes out, you can have email notifications sent to your inbox for papers that flag for being related to search queries or keywords that you have interest in. That can really kind of save you on time and narrow things down. But the downside of using that method is that sometimes papers slip through and you will have wished that you had responded to a paper that didn't get flagged to your inbox. So that's why I always just kind of comb through each issue when it comes out on the journal's website. Another thing that I've done in the past, mainly prior to medical school, was forming a reading pod or like a journal club of just a couple classmates who were interested in a topic, and we would, whenever a new issue comes out, we'd kind of divide and conquer and kind of flag papers for each other. Sometimes that decreases cognitive load and makes it a little easier to get through an entire issue of a journal without spending too much time individually. And then another thing is keeping a parking lot. So once you've scanned the issue, maybe like write a one-line summary about what that publication says, and then provide links for you to reference when you come back and write your correspondence. Kind of just keeps like a nice little short form list. Doesn't take a whole lot of work on the front end. And if you decide not to write a letter, it's kind of like no harm, no foul, right? Like you've read something interesting probably, and then didn't put a ton of work into writing something up. Step 2 is choosing targets in your lane. So as I mentioned, those are the 3 main domains, the training, the lived experience, and the active research. Those are the kind of areas that I focus on. That's not an exhaustive list, but I do think that catches most things that are probably going to be of interest to you. And then kind of like, if we're thinking about this as a decision tree, right? Do I have data, context, or ethical/practical insight that the authors don't include? And if the answer is yes, you should flag that paper for a deep read and see what you might be able to offer in a correspondence. Step 3, once you've flagged those papers that are in your lane, read those papers deeply like a reviewer. So annotations are going to be king here. So I like to focus my annotating around kind of 4 key things, and we'll break each of these down. So the first one is the claim. That's going to be the central thesis of the publication. Usually that's going to be 1 to 2 sentences somewhere near the front. Oftentimes that's toward the end of the introduction section. Then I want to know what method they're using. So methods are going to give us information about things like perhaps sample size or sample selection or data sources, or the stats analyses that are used to analyze that data. There's often a lot of meat on the bone in the methods section to be fodder later for a piece. The next area I like to kind of focus on is the limitations. I know a lot of times people just kind of skim over the limitations, but oftentimes the limitations kind of stake out the blind spots that the readers or that the authors of a paper are aware of, but often the limitations are non-exhausted. So if, for example, you have an area of interest in rural health and the authors use an outdated definition of rural that's not really commonly used anymore in the research world, and then they don't really acknowledge that in the limitation section, that might be worth a correspondence, kind of pointing out that the way that they've structured their analysis is actually not really in alignment with consensus in the field. And so you can kind of couch an entire correspondence by acknowledging a limitation. And maybe you still praise the merits of the paper, but just making sure readers understand kind of what the limits are. The other area I like to focus on are the implications. Oftentimes journals will put this in a little section or set of bullets at the end called the implications for policy and practice. So policymakers and people who are in healthcare usually, or maybe doing benchwork science, you can go there and kind of see how the authors are conceptualizing how their work is likely to be used. And maybe there's something you can offer there, maybe an additional implication that isn't stipulated, or maybe if an implication seems to be overstated or might misguide readers, you can point that out too. I always like to also mark sentences that I can advance. So that means adding data that I'm aware of or context that I'm aware of that the authors might not be, sentences that I can qualify, so offer scoping conditions on, or maybe broaden the scope of, or connect. So what connections maybe did the authors not make to policy or implementation or country or state or local context that I can offer as a reader? I've kind of created this ABCDE menu that I think can be really helpful for folks. So ABCDE is add, bridge, correct, differentiate, and ethics. Add is I'm bringing in missing data or a sharper denominator that isn't discussed in the paper. Bridge is I'm connecting it to a broader topic like public policy or equity or implementation realities that maybe aren't filtering up to the ivory tower where these researchers are writing their papers from. Correcting is maybe I've found a small factual or interpretive fix that I can offer citations for and kind of clarify for readers. Differentiate is where do the findings generalize or not generalize? And sometimes it can be really helpful to talk about, for example, like what populations the data discussed in a publication actually apply to, and maybe what the limitations of that application would be. So, for example, if we're doing a research project on queer people who live in Louisville, that's likely not going to generalize to queer people in Eastern Kentucky, even though it's in the same state. But oftentimes, researchers won't think about rural and urban context and how different it is. And they'll say, their sample generalizes to queer Kentuckians, which oftentimes that wouldn't necessarily be true. Ethics. So, can I offer or integrate a patient or community perspective, or perhaps unintended harms of a paper, and just kind of point out a blind spot that maybe exists? So, when you're writing a correspondence, we're limited by space. So, oftentimes you're only going to be able to pick one of these. That's why I called it a menu. And once you've picked your central idea, try to develop it into a 1 to 2 sentence thesis that you can build your full correspondence off of. Step 5 is the rapid literature recon. So I think the easiest way to do this is to open up PubMed, because we have access to that through UK and oftentimes the databases that kind of stem from PubMed as well. So filter for like the last 5 years oftentimes, and you'll be able to get a sense of what's current in the literature. Another thing that I do is I look for like US government or state government or World Health Organization reports or national registries. These are often not going to be found in your PubMeds and your JSTORs, but they give you publicly available data or context or kind of official guidance that can be really useful as a reference when you're structuring an argument. So whenever I find my articles or my government reports, I save the PDF for those, and then I immediately format a one-line annotation, like how I'm going to use this resource, and then I create the Vancouver style citation for that source, so that when I come back later and I'm integrating everything together, I already have my citation formatted and ready to go. And Vancouver is the style that the Lancet uses, so that's why I mention it here in this context. And then stop when you have like 3 to 6 load-bearing references. And what I mean by load-bearing is they're going to prop up your thesis. So these aren't papers with small n's. These are not, inconsequential publications that kind of are tangential to your argument. These need to be core supporting beams for your thesis, right? We want to build a strong house, and each of those 3 to 6 references need to be, integral to the overall structure of what will ultimately be probably a 400-word piece of writing. This is what I have observed personally in what makes a winning Lancet correspondence, and I did not figure this out immediately. I think I've submitted 5 or 6 correspondences at this point, and I've only had 2 accepted so far. So this is like practical wisdom from what has worked and what seems to have not worked. When you're writing the title for your correspondence, be clear and specific, and also avoid puns or plays on words. I prefer titles that include a verb. So maybe your thesis or a shortened version of it becomes your title. You're making a claim before the reader even gets to your correspondence. Opening line, you want to cite the target paper. So whatever you're basing your correspondence off of, that's what you want to open with. So readers know, like, how am I orienting to this other piece of research literature? And then immediately after that, state your thesis. What is the idea that you are building off of this target paper? After that comes the body. So that's going to be 2 to 3 short paragraphs. Usually each point is going to have like 1 to 2 citations. Sometimes you can fit in like a third point, or maybe you're going to be really ambitious and try to squeeze 4 points into 400 words, which is probably kind of hard to do. And then you've got a closing. That's going to be the so what. You can think of that as your implications for policy and practice. What should readers take away from this, and how might your correspondence be used or referenced or cited in the future? And then housekeeping. Anytime you're submitting to a peer-reviewed publication, they're going to want to hear about your personal affiliations as an author. So, University of Kentucky College of Medicine, maybe the specific lab that you work for, or the department that you have interned in or had a fellowship in. Disclosures, that's going to be any relationships you have with perhaps a professional organization that has given you funding, or a government grant or a private sector grant. Those are things that journals want to know about too, just for ethics. And then if you're discussing any sort of patient-related data that would be, protected by HIPAA, you're going to want to make sure that you've documented patient consent and perhaps even included IRB approval, which would be, I think, sort of ambitious for a correspondence given the turnaround that's expected in a correspondence. Switching gears a little bit, we're going to talk about formatting and submission. These are things that you should know before you start writing. Every journal has specific guidelines, and these are updated periodically, so I'm not including guidance here, so this video can be evergreen. But every journal is going to list, maximum word counts, reference limits, limits on the numbers of tables and figures you can have, even oftentimes limits on the number of authors. So for a correspondence, for example, journals will often set it at like 2 to 4 authors as the limit, which is often less than it would be for a full research manuscript. And I think the feeling is that, how many people can really meaningfully contribute to a short piece like this. Usually this is something that like 1 or 2 people can kind of knock out relatively quickly. And then most journals are going to want you to submit with a cover letter, and sometimes they have forms that are specific to their journal, and pretty much universally there's a conflict of interest form that they'll want you to fill out too. Oftentimes that's a PDF that's available on their website that you can download, fill out, and then upload into their submission portal. A lot of Lancet titles tend to publish a correspondence without formal full peer review, but they still might seek replies from original authors, or maybe even, send it to one expert in the field and have them do kind of a rapid review. My recommendation is that when you're writing a correspondence for any journal, is that you should keep it civil and also maintain an evidence-first tone. The reason for that is that, this is going to be living on the internet forever. And also, as people who are typically early in our careers, we have a lot to learn still. So creating enemies early on probably is not a winning strategy for you. That said, it's perfectly reasonable to point out errors or limitations of a paper in a way that is civil and evidence first, right? So don't shy away from conflict, but be careful in the way that you wage conflict. And then also in a journal like the Lancet, your correspondence is going to be high visibility. So don't write something that you won't stand by 10, 20 years from now. Try to have some forward-looking vision and write something that you'll be comfortable with, mid or late career. My recommendation on kind of writing style is to make every word earn its keep. The immediate poet laureate of Kentucky, Silas House, often says that make your words pay their rent, and if they aren't really propping up your thesis at all, they probably don't need to be there. So brevity is the object, and you want to try to say as much as you can with as little space as possible. So lead with your claim. Don't start with what I would call throat clearing. Get it out. What you're trying to say, be quick about saying it. Don't give us this long exposition before you really get to the point. Try to use nouns more than adjectives. Oftentimes in science writing, adjectives don't really add much value and they provide subjectivity. So try to cut down on those. Nouns are often maybe even more descriptive or specific. And so trying to use, proper nouns to name specific government offices or programs or grant mechanisms or research methods, these tend to be more useful. Active verbs are also useful. You want to write with an active voice. That often also tends to cut down on word count. And then when you're sharing numbers, like in a statistic or something like that, try to include denominators to give the readers a sense of, like, for example, sample size. And also it provides kind of clarity as well in terms of data literacy. One idea per sentence tends to be my rule too. So these are going to end up being short paragraphs. Lancet specifies that British spellings are often preferred. So as Americans, that's something to be mindful of because we're often not using the British spellings of words. And then avoid patient identifiers. So if there's anything related or protected under HIPAA, make sure that we're securing consent and getting institutional approval. There's something called an ICMJE authorship criteria. That's a form that you're going to be expected to fill out. And then you're going to want to list contributing authors, how they contributed, and it's also a place where they're going to have you disclose conflicts of interest as well. Sometimes journals will use the ICMJE form alongside a conflict of interest form. Sometimes they'll only have you submit one of these. So just kind of be aware that not every journal wants the exact same paperwork. And then, as I've mentioned a couple times now, IRB and ethics guidance is something that you should seek out if you have any question about what you're writing. You don't want to, especially early on in your career, kind of sully your academic reputation by writing something that is unethical or doesn't have institutional approval when it needs it. That is a really bad look. I mentioned a cover letter earlier and sort of how submission processes among journals can differ quite a bit. So here's my quick and dirty cover letter advice. Try to include these 3 sentences. What you're responding to, so that's the target article that I mentioned that you need to have at the beginning of your correspondence. And tell the editors what your 1-line thesis is. That's going to be your ABCDE formatted thesis. And then why it matters now. Editors are looking for timely and important information, especially in an internationally recognized journal like the Lancet. And so kind of creating a compelling argument for why they should publish what you've written kind of becomes paramount because they're going to filter through probably hundreds of submissions for correspondences and maybe pick 5 to go with each issue. So try to communicate why yours needs to be one of those 5. I also like to always make a practice of offering exclusivity and confirming originality. So that means I'm not submitting this correspondence to any other journal. It's not under consideration elsewhere. And then also I have written this all on my own. I didn't use ChatGPT. I didn't use my college roommate to write this correspondence and just tack my name on the top of it. And then attach the required forms via the submission system. Sometimes it's really easy to forget to upload the paperwork they want. If you don't upload it correctly, they probably just won't even consider your submission because they don't have to, quite honestly. Timeline-wise, I mentioned earlier on that it's a quick turnaround for correspondence. So you're going to want to draft this within days to maybe 2 weeks of the target article being published. And that's why it's important to stay up to date with each issue of the journal, because the Lancet requires that correspondences be submitted within 3 weeks of the original article's publication. So you have to be timed with your writing and also with your awareness that the target article was even published. And likewise, expect them to be pretty quick on the turnaround about editorial decisions. So depending on your background with publishing, you might know that oftentimes academic journals can take anywhere from maybe 2 to 6 months to get back to you with a decision for publication. This is usually going to be within the week. I've had decisions within 24 hours for correspondences before. So once they accept it, you're going to go through a pretty quick editorial process where someone's going to take a stab at kind of reformatting a little bit, making just suggestions on maybe more elegant ways to state something, or reformatting a citation that you got a little bit wrong. And then they're going to send edits back to you. You have to accept those. And then pretty much as soon as you do that, it's going to be rapidly published online. So correspondences might appear online within a week of when you submit them, which is pretty quick in academic publishing. So, like I mentioned earlier, sometimes the journals are going to solicit a reply from the original authors. So it becomes like sort of a conversation or a series of letters back and forth. So, kind of like I said, like you want to be able to stand by this in 10 years. Your argument needs to be really tight. Try not to leave any room in your correspondence for someone to shoot a hole right through whatever you're saying. And I think maybe it's a pride thing or whatever, but like you want to put something out into the world that's your best work. And I would recommend having other people, maybe mentors or colleagues who have interest in the same topic as you, review your writing quickly and kind of point out what might be your blind spots so that you're submitting a really strong piece of writing to the journal that isn't going to flop as soon as the authors send their reply and point out the giant plank in your eye. I'm going to go through two examples of the correspondences I've had published in Lancet Regional Health Americas over the last year. And I'm just going to kind of walk you through how I approached it. So, step one, we're going to cite the original paper. That's our opening sentence. So you can see I've got that in that first little highlighted part. Then just a little bit later, I say my thesis. So I say, the discourse that is happening between me and these authors can be further broadened through a global lens. So the original paper takes a more regional approach, and I'm saying, this probably applies more broadly. Let's broaden the scope here. So claim one is globally, adoption of family-centered ICU care remains highly inconsistent. And then I kind of break down some of the data related to that using peer-reviewed literature that I got from my literature review. Claim two is children benefit from family-centered ICU care. And then I kind of walk through that using the ethics literature and data we have on childhood developmental outcomes related to, getting to be in the ICU with family members. I provide a counterpoint in this case, anticipating pushback, especially from people who might work in ICUs that currently bar children from visiting family members. And I say that concerns from healthcare professionals need to be addressed, but they can also be overcome. And I talk about how institutions globally are doing the work to make that happen. And then I end on my implication. So that's my, in this case, moral appeal. I'm saying that excluding children from the ICU is bad care. And that's because children are part of families. And if we really want to offer patient and family-centered healthcare, we need to include children in that, even if it's inconvenient for us. Here's my second one. So some of you guys who know me might know that I had a former life at the Centers for Disease Control and Prevention. I worked on the COVID-19 response as a health communicator. So I'm really interested in public health preparedness, especially as it relates to infectious disease. And there was recently a framework published related to H5N1, which is bird flu, about basically how countries should be preparing for the bird flu pandemic that will eventually strike. And so what I offer is that the framework that was published in the Lancet doesn't adequately anticipate the realities of people who live in rural areas. And so I sort of unpack that. So I cite the original paper again. I have my thesis up toward the front where I say, successful implementation of bird flu preparedness requires integration of rural realities. Claim one is that the bird flu panzootic, which is just a pandemic that spreads among animals at first, has largely unfolded in rural areas. If you've been paying attention to the news, you've probably heard about and dairy farms being the site of some of the first human cases of bird flu in the last couple years. Those are happening in rural areas. Claim 2 is that experiences in the COVID-19 pandemic highlight failures to consider rural realities. I mean, I think that's one of the core things right now in the United States with distrust in medicine and public health. We weren't adequately messaging to people in rural communities, and that contributed to a lot of the political polarization that we're experiencing now as it relates to healthcare. So we need to anticipate how we might do a better job of integrating rural perspectives and realities into our public health planning. Claim 3 is that there's already recognized bird flu surveillance enforcement variability in rural areas. So what this looks like is inconsistent testing of milk and eggs, inconsistent screening testing of agricultural workers who might want that screening, but it's not available to them. Claim 4 is that we need to make sure we're thinking about rural labor dynamics. So agriculture is a notoriously unstable and employment endeavor. And so oftentimes people live a migrant lifestyle, move around to different farms or different states or parts of the country. And so sometimes those folks are of varying levels of documentation legally, and we need to integrate what that looks like practically when we need these people to get tested for an infectious disease, because doing so might cause fear of retaliation. Handing over health information, often to a government entity, could be a really uncomfortable exercise for someone who is not a documented citizen or US resident. And that's kind of a critical consideration if we want to contain an emerging pathogen. So, legal protections and health data protection and anonymity become paramount. And then claim 5 is kind of simple. I say we must act now. Time is of the essence. We have a panzootic already, and if we want to prevent this from becoming a pandemic, we need to start integrating these rural realities into our public health preparedness and eventual response well in advance of a pandemic blowing up in our faces. My moral appeal is that good public health reflects the needs, limitations, and strengths of communities, and those just aren't limited to urban centers where most people live. We really need to be intentional about including rural perspectives as well. Here's a sample cover letter that I've included. So I give a salutation to the editors. I tell them the title of my correspondence. I clarify which journal I'm submitting to, because the Lancet is a family of journals. I tell them which target article I'm referencing with my correspondence and how I'm broadening the perspective to a global perspective. I say that my correspondence supports what the authors say, but maybe also kind of modifies what they offer or adds context to it. I say that my correspondence aligns with the journal's mission. I say that it hasn't been published elsewhere and it's not consideration by another publication. And I confirm my authorship. And then I thank the authors. So it's a quick little letter, right? Nothing too fancy about it. Doesn't require an entire page of text, just a couple short paragraphs. And I think editors will appreciate brevity too, because you're not really wasting their time with throat clearing for a really short piece of research information. Common pitfalls that I've noticed are that people will sometimes try to re-summarize a paper. That's not going to be really useful because it doesn't add anything. Vague praise and critique without backing it up with data. You're going to really want to make sure that those citations you share are adequate to support your argument. I think oftentimes people have trouble crafting a clear thesis, which limits odds of publication as well. People often don't pay attention to simple things like the word limits, or they might miss their disclosures that I mentioned, or fail to establish relevance for why it's timely and important. And then, like I said, I didn't get this right on the first time, so practice makes perfect. I would say like if this is something that sounds interesting to you, like make a practice of writing one of these maybe every couple months, or if you're a third or fourth year student and you have a flex month or a lighter elective rotation, maybe that's a time where you can kind of spend some time figuring this process out and kind of building a practice that works for you and it's kind of tailored to your interests and needs. Keep that growth mindset that UK College of Medicine tends to pound into our brains, and also keep persistent. Because if this is a goal that you've set for yourself, you are a medical student, you're smart, and you know how to work hard. So you can do it. Thank you for spending some time with me today. It has been a pleasure sharing with you a little bit about how you can write a correspondence for the Lancet. And I hope to see lots of Lancet correspondences coming out of our student body in the future.